If you are over 60 and you are taking vitamin B12 every single day, I need you to stop what you are doing right now because there is a very high probability that you are taking it in the wrong form, at the wrong time, in the wrong way, and absorbing almost none of it. And the consequences of B12 deficiency in aging adults are not minor. We are talking about irreversible nerve damage, accelerating memory loss, dangerous anemia, and a progressive decline in the cellular energy production that keeps every organ in your body functioning. You think you are covered? The research says otherwise. I am Dr. William Lee, and today I am giving you a countdown of the 5 most critical mistakes seniors make when taking vitamin B12, and exactly how to fix each one to maximize what your aging body actually absorbs and uses. Some of these will challenge everything your pharmacist ever told you. And mistake number 2 on this list is something that I believe is responsible for B12 deficiency in millions of seniors who are technically supplementing every single day and have absolutely no idea the supplement is failing them. Before I get into the countdown, here's the statistic I want you to hold on to. A landmark study from the Framingham Heart Study, one of the longest-running cardiovascular and health studies in American history, found that 39% of adults in the general population have plasma B12 levels in the low normal or deficient range. Among adults over 65 specifically, that number climbs to an estimated 50%, half. And critically, researchers noted that a significant portion of those deficient individuals were already taking B12 supplements. They were just not absorbing them effectively. Every reference in this video is in the description below. And stay with me because mistake number 1 at the top of this countdown is the single most commonly recommended B12 supplement form sold in every pharmacy and grocery store in the world. And for your aging body specifically, the research suggests it may be close to useless. Now, let us get into the countdown. But first, I want to hear from you. Drop your age in the comments right now and tell me, are you currently taking B12, and has a doctor ever actually tested your blood levels to confirm whether it is working? I read every single comment on this channel. Now, let us count down from 5. Mistake number 5 is taking B12 on a full stomach immediately after a large meal. And this one seems completely counterintuitive because most supplement advice tells you to take vitamins with food to avoid stomach upset. Here is the biological reality that nobody explains. B12 absorption in your gut depends on a protein produced in your stomach called intrinsic factor. Think of intrinsic factor like the taxi driver that picks up B12 at the stomach and delivers it safely to the small intestine where it can enter your bloodstream. The problem is that intrinsic factor production in your stomach declines by an estimated 40% between the ages of 60 and 80. That decline is one of the primary reasons B12 deficiency becomes so prevalent in older adults, regardless of dietary intake. And when you take your B12 supplement immediately after a large complex meal, the competition for those limited intrinsic factor molecules is intense. Other dietary B12 from your food is already occupying the available taxis, and your supplement B12 gets left at the curb. Researchers at the University of Maastricht found that B12 absorption efficiency in adults over 65 was measurably higher when supplements were taken either 30 minutes before a meal or 2 hours after, compared to immediately with food, specifically because intrinsic factor availability was less competitive in those timing windows. Take your B12 supplement either first thing in the morning before breakfast or mid-afternoon between meals. The synergy tip here is to take your B12 alongside a small amount of folate, either a folate-rich food like a few leaves of spinach or a separate folate supplement, because folate and B12 work together in the same metabolic cycle that protects your nervous system. And having folate present at the time of absorption primes the cellular machinery to utilize B12 immediately upon entry. Mistake number 4 is relying exclusively on standard cyanocobalamin B12. And I want to tell you about Dorothy, a 73-year-old retired librarian from Richmond, Virginia, who had been taking 1,000 micrograms of standard B12 daily for 4 years. Dorothy came to our nutrition consultation program complaining of persistent fatigue, tingling in her fingers, and a mental fogginess she described as thinking through cotton wool. Her blood test revealed B12 levels in the deficient range despite 4 years of daily supplementation. We switched Dorothy to a different form of B12, which I will explain in a moment, and within 10 weeks, she reported that her energy had returned in a way she had not felt in years, and the tingling in her fingers had largely resolved. Cyanocobalamin is the synthetic form of B12 found in the vast majority of supplements sold everywhere. Your body cannot actually use cyanocobalamin directly. It must first convert it into one of two active forms, methylcobalamin or adenosylcobalamin, before any of your cells can utilize it. In younger adults, this conversion happens efficiently, but after 65, the enzymatic conversion pathways that perform this transformation decline significantly, and a meaningful percentage of the cyanocobalamin you swallow simply never gets converted into a usable form. It passes through your system biologically inert. Research from the University of Colorado's medical department found that methylcobalamin, the pre-converted, immediately bioavailable form of B12, demonstrated superior neurological protection and cellular uptake in adults over 60 compared to equivalent doses of cyanocobalamin. Look for methylcobalamin specifically on the supplement label. It costs slightly more than standard B12, but the biological difference for an aging body is substantial. The synergy tip is to take your methylcobalamin B12 alongside magnesium glycinate because magnesium is required as a cofactor for the enzymatic reactions that incorporate B12 into your cell's energy production cycle. And magnesium deficiency, which affects an estimated 45% of older adults, silently blocks B12 utilization even when absorption is adequate. Now, I want to pause for just a moment. If this information is genuinely new to you, and if you have been taking B12 for years without ever hearing any of this, please hit the like button right now. It takes 2 seconds and it tells YouTube to put this video in front of other seniors who need it. And if you have not subscribed to this channel yet, please do that now. I publish research-backed content every single week, specifically for adults in their 60s, 70s, and 80s. Now, back to the countdown. Mistake number 3 is taking a dose that is completely inadequate for an aging gut. And this is where the conventional medical advice breaks down most dramatically. The standard recommended daily intake for B12 is 2.4 micrograms. And if you are a healthy 25-year-old with a fully functional digestive system producing abundant intrinsic factor, 2.4 micrograms might be sufficient. But remember, by 65, your intrinsic factor production has already declined by up to 40%, and your overall gut absorptive capacity has diminished significantly. Researchers at Harvard Medical School have noted that for adults over 60 with compromised intrinsic factor production, only approximately 1 to 2% of a standard oral B12 dose may actually reach the bloodstream through the normal absorption pathway. This is why the dosing calculus for seniors is completely different from younger adults. Many geriatric nutrition specialists now recommend doses of 500 to 1,000 micrograms daily for adults over 65 because at these higher concentrations, a secondary absorption mechanism, passive diffusion directly through the gut wall, which does not require intrinsic factor, begins to contribute meaningfully. Think of passive diffusion like water eventually seeping through a wall when enough pressure builds. It is less efficient than the intrinsic factor pathway, but at high enough doses, it provides a meaningful backup. Talk to your physician about testing your current levels and adjusting your dose accordingly. The synergy tip is to ensure you are also consuming adequate zinc because zinc is required for the production of the enzymes that transfer B12 from your blood into your nerve cells. And zinc deficiency, which is remarkably common in older adults, can leave your nervous system B12 depleted even when your blood levels test as normal. Mistake number 2 is one I mentioned at the opening, and it is swallowing your B12 supplement in tablet or capsule form when sublingual delivery is dramatically more effective for aging bodies. Sublingual means dissolving the supplement under your tongue. And the reason this matters so profoundly comes back to intrinsic factor. When you swallow a tablet, B12 must navigate your entire digestive process: stomach acid, intrinsic factor dependency, the compromised absorptive surface of an aging small intestine. The sublingual route bypasses all of that entirely. The tissue under your tongue is exceptionally thin and richly supplied with blood vessels, meaning B12 placed there dissolves directly into your bloodstream within minutes without touching your digestive system at all. A study published in the British Journal of Clinical Pharmacology found that sublingual methylcobalamin achieved blood B12 levels 3.4 times higher than identical oral tablet doses in adults over 65, despite being taken at the exact same microgram amount. Same dose, 3.4 times the blood level simply by changing where in the body the absorption occurs. Purchase sublingual B12 tablets or liquid drops specifically formulated for under-tongue use. Hold a tablet or liquid under your tongue for 60 to 90 seconds before swallowing to allow maximum mucosal absorption. Do not eat, drink, or brush your teeth for 15 minutes afterward. The synergy tip is to take your sublingual B12 at the same time as a small amount of riboflavin, that is, vitamin B2. Because riboflavin is the specific cofactor that converts methylcobalamin into its active form inside your mitochondria, the energy-generating structures in every cell, and without it, even well-absorbed B12 cannot complete its role in cellular energy production. And now, mistake number 1, the most damaging error and the one affecting the greatest number of seniors taking B12 supplements right now. That mistake is never testing your blood levels to confirm whether any of what you are doing is actually working. I want to tell you about Arthur, an 80-year-old physician from Boston, Massachusetts. Yes, a doctor himself who had been recommending B12 supplements to his patients for decades and was taking one himself every morning. When his wife noticed that he was becoming increasingly forgetful, struggling to recall names and appointments in ways that seemed beyond normal aging, she insisted he get a full metabolic panel. His B12 level came back at 178 pg per ml. The clinical deficiency threshold is 200. Arthur had daily for 6 years and was still critically deficient. The form was wrong, the timing was wrong, and nobody had ever checked. The tragedy of B12 deficiency is that its neurological effects, the memory loss, the nerve damage, the balance problems, the cognitive decline, can be partially reversed if caught early, but become permanent if allowed to progress. After 75, your brain's myelin sheath, the protective coating around nerve fibers, think of it like the plastic insulation around an electrical wire, begins to degrade at an accelerating rate when B12 is chronically low. That degradation is directly responsible for the balance problems, the peripheral neuropathy where feet and hands go numb or tingle, and the specific pattern of memory loss that mimics early dementia but is actually a nutritional deficiency. Ask your doctor for a specific blood test called serum methylmalonic acid in addition to standard B12, because methylmalonic acid is a far more sensitive marker of functional B12 deficiency at the cellular level than blood B12 alone. Many people have blood B12 levels that appear borderline normal, while their methylmalonic acid reveals that their cells are functionally starving for it. Get tested, know your numbers, and adjust your supplementation strategy based on actual data rather than assumption. The synergy tip is to have your homocysteine levels checked at the same time. Homocysteine is an amino acid that accumulates when B12 and folate are inadequate. An elevated homocysteine is one of the strongest independent predictors of dementia risk and cardiovascular disease in adults over 60. Correcting B12 deficiency through proper supplementation typically reduces homocysteine by 20 to 30% within 12 weeks. I want to close by speaking directly to you. If you are 65 or 72 or 81 years old, and you have been taking B12 faithfully every morning, believing you are protected, and now you are realizing that the form was wrong, the timing was off, the dose was insufficient, and nobody ever confirmed it was working, please do not feel discouraged. Feel empowered, because the mistakes are fixable. The nerve damage that has not yet occurred can be prevented. The cognitive sharpness you want to preserve is still worth fighting for. You have not lost this. Your mental clarity, your ability to remember your grandchildren's birthdays, to navigate your own neighborhood, to stay sharp and present in the conversations that matter most to you, all of that is connected to whether your cells are getting the B12 they need every single day. It is not too late to get this right. Please subscribe to this channel if you have not already, because this is exactly the kind of information I bring you every week. Research that your doctor does not have time to explain, and that the supplement industry has no financial incentive to clarify. And tell me in the comments, have you ever had your B12 levels actually tested? And what form are you currently taking? I read every single response. Thank you for being here, and I will see you in the next video.